Hey, Dr. Stubblefield here again with my adjustment videos. The two adjustments I were given were a C2 prone mylar head of table, which is a right rotation restriction, which would mean a left rotation fixation. So I'm going to be contacting the patient's left side. I don't have a good video of this. I'm going to be head of table. So I'm going to be on again on this patient's left side. We're going to contact C2. We're going to rotate away, and then we're going to thrust. And since it's C2, it's going to be through the nose, is our line of drive through the nose, and that's going to be P to A, L to M, I to S. My next adjustment is a T2 thumb spinous push for a left rotation restriction, which would be a right rotation fixation, so spinous would be left. So I'm going to find the C7 T1 prominence. We're going to go down one. We're going to contact right on the spinous. We're going to traction the patient's head away, and then we're going to push straight L to M, straight across the patient's shoulder. Alright, after these adjustments, I would expect our patient to feel a lot better, especially with all the hypertonicity they have in the traps. For this particular case, I didn't really choose any exercises at first, but what we're going to do is some PIR, some post-isometric relaxation. So for that, we're going to focus on the patient's trap. So I'm going to have my patient turn over and go face up, please. And for the PIR, what we're going to do is we're going to grab the patient's head, we're going to have him in a little bit of flexion, but really we're going to rotate the opposite trap. And to get that, we're going to rotate and laterally flex. We're going to push on this patient's shoulder. We're just going to push down enough to where it relieves, some of the slack in there. And then I'm going to have the patient push against my hand, which is on the top of their head, with about 5 or 10% of their total strength. And they're going to push on that for about 10 seconds. I'm going to tell them to relax. And then we're going to stretch that out a little bit farther. And then I'm going to have her push again, and then relax. And then we would do that bilaterally on both sides. And again, that's to help with some of that hypertonicity in their traps area. Thank you, patient. You can go ahead and get up now. I appreciate it. After my patient leaves, or before, I would have wiped down the whole table with cleaning solution. I would change the face paper. I'd wipe down anything in the room as well. And I think that is it. So again, some findings I'm expecting after I treat this patient. Migraines are kind of tough to work with, and they're can be kind of a handful, so I would expect that not to go away right away, but I think stretching out those traps, increasing the patient's water intake, and of course the adjustment would really help this patient. Thank you.